Hello, everyone, and welcome. I'm Dr. Anya Sharma, and I'm genuinely grateful you're spending a few moments with me today. If you're new here, please know this is your safe space. We are not just about numbers and charts, we are about real people, real bodies, real emotions, and real connections. This channel is a community, a growing circle of us who believe aging isn't a decline, but an evolution into deeper strength, wisdom, and connection. We talk about the things most people are too shy, too busy, or too uncomfortable to discuss, especially when it comes to men's sexual health as we get older. And today's topic is one I approach with deep respect because it impacts so many men worldwide, yet many feel they're suffering in silence. We are going to talk honestly, compassionately, and clearly about erectile dysfunction, something that's often misunderstood or swept under the rug. But this isn't about embarrassment, shame, or frustration. This is about hope. It's about healing and reconnecting with your body, your partner, and yourself. Now, I'd love for you to do something small but meaningful. Wherever you're watching from, whether it's New York or Nairobi, a bustling city or a quiet town, leave a comment below and tell me where you are. I want you to see what I see. You're not alone. This conversation matters everywhere, in every culture, at every age. Together, we are building a global network of shared wisdom, courage, and experiences. So, have you been noticing changes lately? Maybe intimacy doesn't feel the same. Maybe you're avoiding it because something feels different. Or maybe you're deeply in love with your partner, but your body isn't responding the way it used to. If so, you're not broken. You're not alone, and you absolutely have options. What you're feeling is more common than most men realize and more treatable than most doctors acknowledge. Erectile dysfunction, or ED, isn't the end of intimacy. It's your body whispering, asking you to pay attention. It can be a doorway to deeper healing, not just sexually, but physically, emotionally, and even spiritually. In this video, we are going to break that silence. We'll explore what's really happening when ED enters your life. We'll look at the physical causes, the emotional triggers, the impact on relationships, and, most importantly, what you can do to turn things around. No man should carry the weight of silence, and no couple should suffer from a lack of information or support. Before we dive in, take a moment to like this video if you're ready to embrace this conversation with an open mind. And if you're not already part of our community, subscribe and turn on notifications because every week we explore powerful ways to stay strong, age well, and live fully. Alright, let's get into it. Let's start with the body because understanding how it works is the first step to reclaiming your confidence. Think of your body as a beautifully complex orchestra. Every instrument, your heart, blood vessels, hormones, nervous system, must play in harmony for healthy sexual function. When one section is out of tune, the whole performance can be affected. For many of us as we get older, the first instrument that tends to fall out of sync is blood circulation. Achieving and maintaining an erection isn't just about desire, it's about blood flow. When you're aroused, your brain sends signals down your spinal cord to release nitric oxide, a molecule that tells your blood vessels to relax and expand. This allows blood to rush into the penis, creating an erection. But as we age, those blood vessels can become narrowed or stiff due to conditions like high cholesterol, hypertension, or diabetes. It's like trying to water a garden with a kinked hose. The flow just isn't what it used to be. Now, add in hormonal changes. Testosterone, the hormone that fuels male sexual desire and energy, gradually declines after age 30. By the time you're in your 60s, levels may have dropped significantly. That means less drive, a slower response, and more difficulty achieving satisfaction. Then there's muscle control, especially the pelvic floor muscles. These small but mighty muscles support erection firmness and ejaculation control. But like any other muscle, they weaken without use or targeted exercise, leading to less rigidity and control. I know that sounds like a lot, but let me tell you something important. This is not permanent. This is not hopeless. This is not the end of your intimate life. In fact, it's the beginning of a deeper awareness of your health and a launchpad for meaningful change. Let me share a quick story. A few years ago, I had a patient, let's call him Michael, a 67-year-old retired teacher. He came to me embarrassed, convinced his intimacy with his wife of 35 years was over. He blamed himself, thought it was just age. But after a few basic tests, we discovered he had undiagnosed high blood pressure and low testosterone levels. With medication, tailored exercise, and a shift in his diet, not only did his erectile function improve, but his energy returned. He told me, "I feel 20 years younger and more connected to my wife than ever." Michael's story isn't rare. It's possible, and you deserve the same chance. So, let's talk action. Here's what you can start doing right now to support your physical health and sexual vitality. Walk for 30 minutes a day. Walking improves blood flow, heart function, and even testosterone levels. It's simple, free, and powerful. Try Kegel exercises. Yes, men can and should do them. Squeeze the muscles you use to stop urination. Hold for 5 seconds, then release. Do this a few times a day to build pelvic strength. Eat a circulation-friendly diet. Load your plate with leafy greens, watermelon, pomegranates, beets, and healthy fats like olive oil and salmon. These foods boost nitric oxide and promote blood vessel flexibility. Get your testosterone checked. If your libido is low or you're experiencing fatigue, a simple blood test can help determine whether hormone support could help. Limit sugar, alcohol, and processed foods. These cause inflammation, which damages blood vessels and leads to sluggish circulation. Everything I've just mentioned doesn't just improve sexual health, it strengthens your entire body, your brain, your heart, your muscles, and yes, your relationships. You deserve to thrive, not just survive, in this stage of life. Now that we've explored the physical side, let's shift into something just as important, but often ignored, your mind. Many men believe erectile dysfunction is purely a physical issue, but here's the truth that isn't spoken about enough: your brain is your biggest sex organ. That's right. What you think, feel, and carry emotionally can either support your body's natural response or completely block it. Let me ask you something personal. Have you ever felt the pressure to perform? And the more you thought about it, the harder it became to respond? That frustration, that feeling of letting your partner down, it creates a cycle, a feedback loop of anxiety, tension, and disconnection. This cycle isn't your fault, but you can break it. Let's break it down. Anxiety triggers cortisol, your body's main stress hormone. High cortisol constricts blood vessels, lowers testosterone, and floods your system with fight-or-flight signals, the exact opposite of what your body needs for intimacy. Depression or feelings of inadequacy can numb your emotional and physical responses. You might not even feel desire, not because it's gone, but because it's buried under layers of fatigue and emotional pain. Relationship tension, even subtle, can create a sense of pressure or disconnection. If there's unspoken hurt, misunderstandings, or emotional distance, it often shows up physically. But here's the good news: you can take your power back. Let's begin with your breath. Practicing deep breathing before intimacy can relax your nervous system and calm performance anxiety. Try this. Inhale for 4 seconds, hold for 4, exhale slowly for 6. Do this for a minute or 2. This simple rhythm signals safety to your body, letting arousal flow more naturally. Next, consider mindfulness or meditation. These aren't just spiritual buzzwords. They're scientifically backed tools for reducing stress and restoring emotional balance. Even 5 minutes a day of focused stillness can improve emotional regulation and strengthen intimacy. But perhaps the most powerful tool is communication. Gentlemen, this part is so important. If you're experiencing ED or struggling with desire, talk to your partner, not with shame or blame, but with honesty and trust. I'll never forget Daniel, a 72-year-old who came to me with tears in his eyes. He had avoided intimacy with his wife for over a year, afraid she'd think he was no longer attracted to her. When he finally opened up, she broke down, not out of anger, but relief. She thought she was the problem. That one conversation changed everything. They began walking daily, cooking together, laughing again. When he returned to my office months later, he smiled and said, "It wasn't about pills. It was about reconnecting." You see, intimacy is more than sex. It's about being seen, accepted, and held in love. When you invite your partner into your struggle, you turn it into a shared journey, not a solo burden. So, if your mind is getting in the way of your body, remember this: you're not broken, you're not alone, and you're not too late to reclaim your confidence and closeness. Now that we've explored the physical and emotional layers of sexual health, let's talk about the solutions available to you: real, science-backed tools that can restore function, confidence, and connection. We live in a remarkable time. Men today don't have to suffer in silence. Advances in medical science and natural therapies are helping millions of men reclaim their intimacy. But navigating these options can feel overwhelming, so let's simplify it. 1. Oral medications. You've likely heard of sildenafil, commonly known as Viagra, or tadalafil, Cialis. These medications are part of a class called PDE5 inhibitors. They work by increasing blood flow to the penis, making it easier to achieve and sustain an erection when you're sexually stimulated. Now, here's the key: they're not aphrodisiacs. These meds don't spark desire, they simply help your body respond when you already feel aroused. And when combined with emotional intimacy and confidence, the results can be powerful. But remember, always consult your doctor first. These medications aren't safe for everyone, especially if you're taking nitrates for heart conditions. A personalized medical approach matters. 2. Low-intensity shockwave therapy. This therapy uses gentle sound waves to stimulate the growth of new blood vessels in the penis. Think of it as encouraging your body to repair and rejuvenate itself. It's non-invasive, requires no pills, and some studies show long-term improvements in erectile function. It's especially helpful for men who want to avoid daily medication or haven't responded well to pills. 3. Testosterone replacement therapy. If you're feeling persistently tired, unmotivated, or have lost interest in intimacy, it could be due to low testosterone. This natural decline begins around age 30 and can drop steadily over the decades. TRT can come in the form of gels, injections, or patches. It not only boosts libido but may also improve energy, mood, and muscle strength. But, and this is important, TRT isn't for everyone. It must be guided by lab testing and monitored by a knowledgeable doctor to ensure safety, especially regarding heart and prostate health. 4. Acupuncture, the ancient tool with modern support. You might be surprised, but acupuncture has shown promise in helping with erectile dysfunction. It works by reducing stress and enhancing blood circulation, and many men report feeling more relaxed, more in tune with their bodies, and, yes, more aroused. It's an excellent complementary treatment, especially for men who want a holistic, drug-free option. 5. Sex therapy and counseling, healing the mind, enhancing the bond. Sometimes the biggest obstacle isn't your body, it's what's going on inside your head or in your relationship. Working with a licensed sex therapist can help you explore beliefs, patterns, and anxieties around intimacy. If you're in a relationship, couples therapy can also rebuild communication and closeness, turning emotional distance into connection again. And let me tell you, this is not a weakness. Seeking help is a strength. I've seen men walk into my office with slumped shoulders and shame and walk out months later holding their partner's hand, smiling like they're 25 again, because healing is possible. Let's be clear, medical treatments help, but your lifestyle is the soil where your health either flourishes or fades. Think of it this way: even the best medication won't work as well if your body is stressed, inflamed, or malnourished. Here are 5 daily habits that, when practiced consistently, can create a solid foundation for sexual vitality and emotional intimacy. 1. Move your body every day, no excuses. You don't need to become a marathon runner, but daily movement is non-negotiable. Brisk walking for 30 minutes, swimming, cycling, or even dancing in your living room gets your blood flowing and boosts your cardiovascular health. Remember, better blood flow equals better erections. Exercise also increases testosterone levels naturally, improves your mood, reduces stress, and keeps your joints mobile and pain-free. And don't forget about Kegel exercises for men. Yes, you heard that right. Strengthening your pelvic floor muscles, the ones that control urination, can drastically improve your ability to achieve and maintain erections. Just like any other muscle group, they need training. 2. Eat like you love yourself. What you eat directly affects your hormones, blood vessels, and even your desire. Foods rich in nitric oxide, like beets, spinach, arugula, and watermelon, help dilate blood vessels and improve circulation. Add in healthy fats like olive oil, avocado, and wild-caught salmon to support hormone production. Cut back on processed sugar, fried foods, and excess alcohol. These are libido killers that clog arteries and mess with testosterone. Want a quick fix? Try a smoothie with banana, spinach, pumpkin seeds, and almond milk, a libido-boosting blend that tastes great and fuels your body from the inside out. 3. Prioritize sleep. That's when healing happens. Sleep is not laziness, it's restoration. Your body produces testosterone during deep sleep. Poor sleep equals low energy, irritability, weight gain, and, yes, erectile problems. Aim for 7 to 9 hours of restful, uninterrupted sleep. If you're struggling, reduce screen time before bed, keep your room cool and dark, and avoid eating right before sleep. 4. Master stress. It's not just in your head, it's in your hormones. Stress increases cortisol, and when cortisol goes up, testosterone goes down. Chronic stress also constricts blood vessels and increases inflammation, 2 things you don't want if you're trying to improve sexual health. Try meditation, deep breathing, or simply sitting quietly in nature. Even 10 minutes a day can reset your nervous system. Another tip, laugh more. Watch a funny show, share a joke. Laughter lowers cortisol and boosts oxytocin, your connection hormone. 5. Nurture intimacy, not just sex, but emotional closeness. Finally, remember that intimacy is more than performance, it's about presence. Take time to really talk with your partner. Share fears, share memories. Ask them what makes them feel loved, not just in the bedroom, but in daily life. Cook together, take walks, hold hands. Small gestures build trust, safety, and emotional warmth that fuel desire. One of my patients once told me, when I stopped trying to impress my wife and started really listening to her, everything changed. We didn't just reconnect, we reignited. That's the beauty of this journey. It's not just about fixing a problem, it's about becoming more aware, more present, and more empowered in every part of your life. So, here's what I want you to take away from this. Erectile dysfunction is not a failure, it's a signal, one that your body and soul want you to listen to. You are not alone. Millions of men are navigating this same path. And most importantly, you are not powerless. By focusing on blood flow, hormone health, stress reduction, communication, and modern medicine, you can experience a whole new level of confidence, intimacy, and joy, no matter your age. If this message resonated with you, let's keep the conversation going. Drop a comment below. What part of today's message resonated with you most? Have you tried any of these lifestyle shifts or treatments? I read every single comment, and your story could give someone else the hope they need. If you found this video valuable, hit the like button, subscribe to this channel, and ring the notification bell. That way, you will never miss a moment of this journey toward empowered aging. Thank you for spending time with me today. This is Dr. Anya Sharma cheering you on as you rediscover strength, passion, and purpose in this beautiful season of life. Remember, you are not done, you are just beginning. See you in the next video.